Sensora Therapy is a unique system which activates the senses by combining colour, sound and vibration all in one experience. It was developed by Canadian physicist Anadi Martel. The Sensora creates an incredible experience of upliftment, joy and peaceful balance. The geniusly designed system uses waveforms and frequencies of colour, sound and vibration intertwined cleverly into a program which has a specific therapeutic action. The programs can either energise, tranquilise or harmonise the autonomic nervous system depending on your individual needs. By engaging our senses with specific frequencies, colour combinations and pulsations, the brain and body entrains itself or resonates to natural rhythms in a coherent manner, quickly bringing it back into a state of balance. What conditions can the Sensora be used for? The Sensora has been used effectively to bring about significant changes and benefits in the treatment of numerous mind-body ailments, including post-traumatic stress disorder, PTSD, depression and burnout, chronic fatigue, insomnia, addictions, recovery from trauma and crisis, attention deficit hyperactivity disorder, ADHD, anxiety, distress, mental tension, chronic pain, fibromyalgia, palliative care and tinnitus. So how can just colour, sound and vibration have a healing effect? There's many ways in which colour, sound and vibration can have a therapeutic effect. Firstly, simple coloured light entering via our eyes, even to our skin to a certain extent, has a powerful effect on our brain neurochemical receptors and also our little mitochondria, which are our energy production generators in every cell. The light, in a sense, acts like a type of energy nutrient or tonic for our whole body, just like sunlight is to plants. All light, sound and vibration has a specific frequency or rate of pulsation. When these pulses or frequencies are strong enough, they can cause the body and brain to entrain, which means they begin to resonate at exactly the same frequency of the light and sound. This entrainment or resonating phenomena has been observed and well established in many instances, such as when a person goes into a type of hypnosis or sleep when driving with reflective road lights shining in their eyes at a certain rate, or even when the windscreen wipers putting out sound at a certain low frequency starts to entrain the brain. In this same manner, colour and sound frequencies can also be used powerfully together to induce changes very easily and very quickly of our cardiac rhythms, our brainwave states, and our breathing respiratory rhythms. When the correct frequencies are chosen, as in the case of the Sensora system, the brain and body will quickly follow suit with induced healing benefits. This technique is sometimes known as audio-visual brain entrainment. Additionally, another therapeutic tool is interwoven into the Sensora. It's called lateral light therapy. This is a brain and psychotherapeutic tool designed by a Russian psychiatrist, Dr. Chuprikov, and it's still relatively unknown in the West. Chuprikov discovered that when a stimulating colour is shone onto the outer periphery of the left eye, the signal is sent to the right side of the brain, crossing from left eye to right side of the brain in the chiasmic optic nerve. The outcome is a stimulation of the right side of the brain, which he found to be really useful for those who were suffering with anxiety, nervousness or insomnia. The opposite was also true. He found that when stimulating the outer peripheral side of the right eye, where the left brain would become stimulated, the outcome was an increase in energy and an upliftment in mood, useful for treating depression or low energy. This system has been tested in clinical studies conducted in Russia and Ukraine. My description of this lateral light therapy method is ultra simplistic. In fact, there's much more refining and complex aspects to the therapy. The important thing to know is that Anadi, the creator of the Sensora, has geniusly entwined this method into the Sensora programs. Finally, but definitely not the least, the Sensora adds therapeutic benefits by providing an experience of great beauty and pleasure. And we all know the benefits of joy hormones in our body, like endorphins, which are not to be underestimated in their healing effects. So, are there any studies validating the Sensora's effects? A recent clinical study on the effects of coloured light for mental health using the light modulation technology, as in the Sensora system, was published in 2013 by a Dr. Ross, Dr. Guthrie and Dumont in the Advances in Mind-Body Medicine Journal, Volume 27, Number 4. A total of 117 people participated in 2 locations, 40 in Texas and 77 in Quebec. The study protocol involved both physiological measures such as heart rhythm, heart rate variability, skin conductance, and also psychological measures such as the POMS profile of mood states and subjective mood evaluation. It concluded that light modulation sessions are significantly correlated with higher well-being and coherence, as well as reduced mood disturbance. They were shown to have a dual effect, simultaneously achieving both deeper relaxation and also enhanced alertness. This effect came without any conscious effort from the subjects. The resulting mind state was described to be similar to the meditation state, a little bit like the peak performance state, which holds great potential for therapeutic healing effects. The Sensora has also been used by a number of therapists in Europe, America, Australia, and South Africa. There's a growing number of case studies that are now available showing the remarkable results of this technique. So, how long does a session last? Each session is usually 24 minutes long. However, there's also 10-minute and 15-minute sessions. Additionally, sessions can be stacked together to experience several sessions in one sitting. How many and how often should someone have these sessions? Well, that's entirely up to the individual's preference. However, for acute or severe conditions, typically 4 to 5 sessions in a short period of time, say for example every day or every second or even third day, is probably best. After that, for general maintenance, just once per fortnight or once per month may be enough. If the condition is chronic and not so debilitating, just having 1 or 2 sessions per week for a series of say up to 8 or 10 sessions would be helpful. However, in my opinion, having frequent and regular sessions enhances our emotional and mental well-being, a little bit like a maintenance upkeep. It's a bit like doing regular meditation sessions. So in my mind, the more often, the better. Are there any individualized sessions? There is one program named Balancing, in which the recipient undergoes a short 5-minute colour selection test based on eliminating your least desirable colours from an array of colours. From those results, an individualised program is formatted. Typically, in an individual program, colours which are comfortable and easy to you are introduced first to make you feel very relaxed. Gradually, small snippets of the uncomfortable sometimes known as the allergic colours, are introduced into the program. In this way, a type of small homeopathic dose and exposure of the difficult colours are given to the person. The effect of this is usually an opening or releasing of difficult emotional past memories. The reason this occurs is that colours have a strong association for emotional memories, difficult colours relating back to challenging past memories. The goal is to be able to digest and assimilate these difficult past experiences by being exposed to the difficult colours, little by little, so the person can build up a more rounded emotional resilience. And the good thing about this, it all bypasses conscious recognition. It's as if it goes straight to the subconscious, doing its work. The colour test that's used for this balancing program is designed by a French colour therapist and inventor, Pierre Aubergarten. What are some of the programs that you'll be able to choose from? There's several different categories of the programs for the Sensora. There's the energising programs designed to uplift and energise the mood and energy. They're best done during the day. Some of them use quite intense, vibrant and activating colours. Then there's also the relaxing program series, which tranquilises the mind, the breath and heartbeat. These can be done for anyone needing help relaxing or relief from anxiety or insomnia. They're perfect for day or night use. Then there's 6 programs with the lateral light therapy series. They're loosely divided into 2 main categories, one category stimulating the right brain and one for stimulating the left brain. There's 3 programs which are guided meditations using the calming French female voice accompanied by music. And finally, the balancing programs, as I mentioned before, which are based on your own personalised, individualised colour selection test. All the programs come with music and synchronised vibration in the reclining massage chair. What's the environment that you'll be in for this session? A purpose-built dome, approximately 3 metres in diameter, houses the Sensora system. It's a standalone structure located near Fremantle in Western Australia. The dome is constructed from natural materials such as hempcrete, render on the outside, gypsum plaster, natural paints, and pure wool carpet on the inside, all for an optimally healthy experience. Inside the dome, it's very dark to enable the full and effective illumination of the colour session. The acoustics of the dome are unique, enabling the surround sound system to have depth of effect. Additionally, the self-reclining comfortable chair, which is located right in the centre of the dome, has 6 transducers embedded inside of the chair, sending vibrations throughout your whole body at a synchronised rate with the surround sound. While you're in the reclining chair, it allows you to gaze upwards at a huge spherical white screen, which is actually the inside wall and ceiling of the dome. This fills your entire visual field. And at the very centre of the screen, there's a small red light covered by a quartz crystal which pulsates to enhance your brain frequency entrainment. Are you alone during a session? All sessions, except for one, are encouraged for you to be alone inside the dome for privacy and personal space. The one program of exception is the Art of Dying program, which can be an intense transformational journey. So it can be often advisable to have a therapist inside the dome during that session, but it's not essential. I really hope at some stage you can experience the power of light and sound in this truly amazing system.